There's a lot in the news today, and we read about and see about panic attacks or anxiety attacks. What is a panic attack?
A panic attack is a, uh, a shot of the body's emergency stuff. Some people think of it as adrenaline, but it's basically the animal part of the brain sending out messages of survival, life or death, in response to some sort of stimulus. That stimulus could be a 50-foot monster that appears in front of you right now, or it could be something coming from inside your own mind that you're not even aware of. But once that part of the brain, which has been around for millions of years in animals, once that part of the brain is stimulated, it responds with a fight, flight, freeze response, as if survival is there. And you get filled with the body stuff for emergencies.
What are the symptoms of a panic attack?
Usually it's the feeling that you're having a heart attack because your heart starts beating much faster. You find yourself sometimes feeling a pain in your heart area, sometimes coming from the stomach area, sometimes up higher. You find yourself not knowing why all of a sudden your breathing is very labored and very fast. You find yourself not able to know what's going on, and you become very afraid that you're going through something that won't go away and that may actually be the end of your life. In truth, more people wind up in emergency rooms thinking they're having heart attacks when they're actually having panic attacks or anxiety attacks than anything else. And to a great degree, people wind up feeling having the same reaction, sometimes to indigestion reactions. You don't know whether you're having a heart attack, you don't know whether you're having an anxiety attack, unless you actually have the experience of having dealt with them before. And there are a variety of ways of coping with it that will help you to differentially diagnose whether it's an anxiety attack, a heart attack, or something else.
So how would one distinguish between them? Because obviously, if it's a heart attack, you might need help right away. Is there a quick way to tell whether it's a heart attack or a panic attack?
Well, the way I recommend is that a person actually do diaphragmatic breathing. 6 or 7 diaphragmatic breaths usually will tell you whether you will either feel better after doing that or you won't. And if you feel better after doing that, then it's probably an anxiety attack. If you don't feel better, then it probably is time to go to the emergency room. There are a variety of possible explanations for it, only one of which is the heart attack explanation. There are medications which people can take, because if you think of it as an adrenaline hit lasts for about 20 minutes. And so if a 50-foot monster appears in front of me right now, and I'm not going to be going to sleep for the next 20 minutes. The reality is that my body is full of the emergency stuff. On the other hand, if you take certain medications at the moment that you have that, the most commonly used one, I believe, is Xanax, which is a prescribed medication, then it prevents the second adrenaline hit. It has a very short half-life, and it's a relaxant, and it does work in that way. But the easiest way to do it, I think, is to try the diaphragmatic breaths and see if that in fact helps.
Okay. So can you demonstrate this diaphragmatic breathing?
People are willing to put up with my slightly overweight stomach. Yes.
Okay.
Let me move back here, and I'll move the chair over here. Take my vest off so I can expose my pudginess. How's this? Can you see me okay?
Just move a little towards the center of the screen and move a little bit back.
And back, like over here?
Yeah, that's fine.
Okay. So the diaphragm is at the bottom of the lung cavity. If you put your hand on your stomach around where your belly button is, and when you breathe
Can you walk forward one step?
forward one step like this?
No, no, not towards the camera.
This way?
That way. There you go.
Okay.
That's fine.
Okay, if you put your hand on your stomach around where your navel is, and when you breathe in, your stomach goes out. In order for that to happen, your diaphragm has to extend at the bottom of the lung cavity. So I'm doing a diaphragmatic breath right now. And when I breathe out, my stomach goes back in. Again. If you do 6 or 7 of those breaths, and you don't find yourself feeling better, more relaxed after doing that, go to the emergency room, call an ambulance, because it may not be an anxiety attack. If you do find yourself feeling better after that, then it probably is. And wait 10 or 15 minutes and see if it disappears, if the feeling of anxiety doesn't go away necessarily, but it's less. So if after doing that, you can prevent the second adrenaline hit by diaphragmatic breathing or by Xanax or by some other technique. One person suggested just walking around, doing meditation, and walking meditation, such as the ones that were developed by Thich Nhat Hanh and many others, should also relax you. In fact, the main thing that meditation does is to relax you. So if relaxation exercises don't work, it's probably not an anxiety attack.
Okay. Is there any kind of long-term, some kind of treatment that would stop you from having anxiety attacks? Or is this a chronic thing that needs to be treated as it happens?
Well, an awful lot of people that I've seen walk around with 10 Xanax pills in their pocketbook or in their wallet, and don't use all 10 in a year. And
Okay.
the truth is that you don't necessarily know what the stimulus is that causes an anxiety attack if there isn't any monster in front of you. On the other hand, the stimulus doesn't matter if you know you have a way of dealing with it that will keep you out of the emergency room and keep you from the medical systems. At the same time, once a person knows that it's an anxiety attack, that they believe that the animal part of the brain, which is millions of years old, is freaking out the neocortex, which is the part of the brain that most people think of as making us human, and that's only been around for a few 100,000 years. Once you understand that your neocortex is responding as if this is a life or death situation, then you can relax and it doesn't freak you out as much.
Okay. So having a panic or an anxiety attack does not signal some kind of mental health problem. It's something that almost everyone is subject to.
Yes. The truth is that everyone has to deal with the fact that we have an animal part of our brain inside us that can make us believe at any given moment that we're in a life or death situation when we're actually not. That part of the brain doesn't discriminate anything other than uh-oh, watch out, this is a life or death. Now everything else get out of the way. It's a matter of, are you going to fight? Are you going to fight? Are you going to flee? Are you going to stiffen? Are you going to be a female lion, which is basically fighting? Are you going to be a rabbit, which is basically fleeing? Are you going to be a possum, which is basically freezing? And that part of the brain exists in everybody. So we're all animals, and we all have parts of the brain that can respond in any of those ways.
Okay. Well, thank you very much, Dr. Neal. It's nice hearing from you. And,
Good talking to you.
we hope to
Brother.
have many conversations in the future.
Look forward to it.